Okay, we are recording.
All right, call this meeting to order. I get to fill in today as the chairperson. Got a roll call?
Got that?
All right, so we don't have a quorum today, so there'll be no voting. Today will be informational only. Can we start with the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Yes, I know what you mean, too. Okay. Do we have any call to the public? Haven't received any.
No, sir. We have none.
Okay. We can't approve the minutes because we don't have enough for a second and a vote. So, time for CRAHBT report.
Mr. Chairman. Trustees, I appreciate the time. And for those who maybe have just met me, again, my name is Chuck Nelson. I'm the representative with CRAHBT. And I'm going to be presenting basically an overview and a snapshot of this year's numbers, claims, utilization, compared to 2017-18 numbers. So it's really a comparison. We're going to look at key findings. We've got demographics, utilization review, and then we'll review some of the CRAHBT programs. Okay, no problem.
Go ahead. Sorry, we're trying to check for you.
Yeah, no problem. And I'm on page 4 of the presentation.
Do you want to hold 1 second? Because we're on this, right?
Yes, we are.
So that way maybe we can pull it up for everybody. to
That would
see.
be great. Yes, I can hold. Yeah, absolutely.
Thank you.
Do you have any more copies, Chuck?
I've got a handful, but I don't have enough for everybody.
Okay.
Oh, that'd be great.
Okay, in the future for all the vendors, we're probably gonna have to start bringing about 20 copies for everybody, as opposed to just for the trustees.
It's coming. I just saw it turn on.
Price to warm up.
Has to warm up. No. It has the display.
It's a hope.
Sorry for the hold up, everyone. My fault.
We didn't know that you needed that.
Yeah.
Well, I'm sure you're gonna enjoy this. Not now.
It's not mine. It's not going to mine.
There you go. It's because you're signing on to somebody else's computer. Mhm. Mhm.
Right. It is hard when you have no money to watch
Yay!
All right, there we go.
Here we are on. Tell me I don't have a recording here.
I'm not seeing it.
Went through all this for nothing,
Look at the next guy.
at least for the next person. Is it not there? Okay.
You have
Yeah.
that.
They're making copies right now of that.
Okay.
Is it not there?
I don't see it.
Okay, sorry.
So I'm on page 4, which is the key findings for 2018, 2019, compared to the numbers from 2017 to 2018. Overall claims are trending down 19%, 19.4%. Professional claims have increased by 4.9. Professional claims are going to be your doctor visits and your specialist visits. Inpatient facility claims decreased by 57.9%. That's obviously great. That's a great number. Not sure. I think maybe more people are taking advantage of outpatient as opposed to having to be have a hospital stay. Outpatient facility claims did increase 8.2, but not a ton. So 8.2%. And then pharmacy claims decreased 1.7%, which is great. Right now, the average for most of the school districts, it's been increasing about 15 to 20%. And that's really because of the brand name scripts that are out there. You see all the commercials on TV. You know, that's what's driving costs up. Your costs actually on the pharmacy end of it is going down, which is great. Large claims over $50,000. Currently, right now you have 12 large claims over $50,000. Out of those 12, 8 large claimants are over $100,000. And then out of that 12, you've got one claim that's over $600,000 right now. So some high claims in there, but again, based off of the numbers that you had the previous year, you're still trending down. And then your emergency room usage, overall number of ER claimants decreased 79 claimants down to 58. Total amount paid increased approximately 60%, which tells me that folks are using the ER for the right reasons. You're going to the ER because it's a life-threatening situation. So that increase doesn't surprise me, as long as it's being utilized correctly. You do have one member who used the ER over 8 times. So it's only one. If you had several that were using the ER as like a family physician or just to go in and get a flu shot, it could be an opportunity for education, some more communication pieces from us to be able to send out to the members. And then last year, average cost ER visit was $766. This year increased to $2,711 per visit. Again, the reason for the increase is probably the utilization is correct. They're going in for a severe injury.
It's weird that it went, we had less claimants, but yet it increased so much.
Right, absolutely. So yeah, so that per dollar amount increase is reflective of that, or reflective at least of the fact that they're utilizing that plan a little bit better. On page 6, the demographic summary. Nothing really stands out here in regards to your demographic changes from year to the next year, except for at the very bottom there, you've got percentage of females between 20 and 44. You've got a little bit higher, trending up 11.9%. The only reason why you track this a lot of times is, again, those are years that folks are going to be starting families, so that's where claims can come in. You really want 99.9% of males between the age of 18 and 19, and your claims will be excellent.
Until they reach 60.
Right.
And then at 60, it goes downhill for the males.
Oh, yeah, absolutely. Absolutely. On page 7, or actually, I'm sorry, 8, we've got our loss ratio from July to June of 2018. So this is the previous year. You were running at 143.54% loss ratio, compared to the next page, which is page 9, you were running 95.32. Again, you're progressing in the right direction. We want things to go down. We want that number to be in that, I think overall you ended up at, with what we looked at, you were at about 86% loss ratio for the renewal is what we were looking at. And you're progressing in that direction, which is really good.
And Chuck, just
Sure.
for the benefit of everybody, this does not include your fixed expenses.
No, this is not. These are just pure claims.
No fixed expenses.
Yes.
No reinsurance, no administration.
Right.
None of that is included in this. And do you have kind of an idea of what ASBATE has for as far as retention?
I know what our fixed expenses are. Our fixed
Yeah.
expenses are anywhere between 6.5 and 8.5%.
Okay.
So, which comparatively, when you look at a Valley Schools or anybody else like that, they're in the 13 to 15%.
Well, most insurance companies are in the 20%.
Right, exactly, exactly.
So you're at 6 or 7%, that's well below market.
Sure, absolutely.
But
Now-
my point is
I'm
that
sorry.
you can add 6% to those numbers to really get a true reflection of premium versus expense.
Right, exactly, absolutely. On the next page, on page 10, this is what I like to show folks, because this is really what underwriting is going to look at when we start looking at renewal numbers. And this is a way for us, when we meet on a regular basis, to hopefully be able to project where that renewal is going to come in at. So we want to look at claims only from February of 2019 to January of 2020. And the reason why we do that is February and January are typically really good low claim months. So that actually helps you in regards to what we look at for the renewal numbers. Again, that all figures in. So right now I've got numbers up to June. I know that David handed out this little piece of paper right here, which should be right in front of you as well. These are your claims from July. So your claims are in the little green box compared to the yellow box. So you had a great July. That's all I can say. If we had a month like that every single month, we would be giving you a decrease in your premiums. You know, you're running
And
at
I'll hold you to that.
32% loss ratio. That's excellent. You can. You can.
Oh, I will.
I know you will. On the next page, we've got expenses by service category. That's on page 11. This is a breakdown, really, of inpatient facility. We talked a little bit about this in the overview, but here's the actual numbers and how they break down. If you look at the very bottom, you'll see summary. You got July 18 and 19. Your paid is $3,487,107. If you look at the yellow, which is July 17 through 18, your paid is $4,327,540, which again it's trending down at 19.4%. That's what we talked about in the overview. So these are those numbers, and that's where I get these numbers from when we talk about hey, you're trending down, your inpatient facility, is down 57.9%. Your outpatient facility is at 8.2% of an increase. Again, not too high, but at the same time, we want to make sure it's not too high. But that's where these numbers come from. On the next page, which is page 12, these are your high-cost claimants from 2017-18 compared to 2018-19. Again, everything is de-identified. We obviously don't want to, put a spotlight on anybody, but these are the actual claims for your trust. 2017-18, at the very bottom, you'll see there, these are just the top, I think that's 15 right there. You're at 3 million. And then on your 2018, you're at 2.4 million, and you don't have as many that are as high. It just gives you an idea of kind of what's going on in the health of your population.
So we got 14 people in 17-18
Right.
that created 3 million, if you discard other, that created
Right.
3,066,828. 14 out of 350, no, 447. So 14 top people out of 447 belly buttons
Right. Yep.
created
3 million.
Yeah.
Yeah, $3
The
million
lion's share
in
of
claims. Absolutely. And that's how it is. What we're talking, 10%, 8%,
Yeah.
7 to 10% of the folks are going to drive the claims. Again, and I've highlighted the one, you've got last year you had the one that was over $1 million. You had one claim over $1 million. This year so far, you've got one claim that's over 600,000. Again, there's things that we can't do. We can just cover it and make sure that it gets paid and make sure that those people are getting the care and the treatment that they deserve. Regardless of how high that cost is going to be, we want to make sure that they have the best coverage possible.
I also noticed the lowest 5 on 2018-19 are lower than the amounts listed in 17-18.
I'm sorry, what was that?
I noticed that the lowest 5 listed here in 18-19
Right.
were all lower than the breakdown on 2017-18. They wouldn't have made the list.
Yeah, exactly. Absolutely.
So it seems like we have half as many over that mark as the year before.
Right. I mean, you're looking at a small picture, but these are the highest claims out of anybody in your population.
Mr. Chairman?
Yes.
Can I ask you just a quick clarification? On the 2018-2019 side,
Yes.
looks like coded site 696 is listed twice. Was that a typo, or one category was repeated, or is that the cumulative?
That's two different people.
Two different people.
Gotcha.
Oh, okay. I see it too.
Thank you.
Chuck, can you explain what, on the 18-19 side, the VO5, the need for prophylactic vaccination? Is that one person? Is that multiple people?
This is one person.
Okay, thank you.
Yeah, each one of those
Boxes.
lines, if you will, in the tan are one person.
And you'll see some of them have two boxes. Like if you look at 572 under 2018-2019, you'll see that there's a box that says 282,958 and then another box 25,000. Those are just two separate claims
For the same,
Okay.
for the same, yeah,
For the same person.
yes, exactly.
in the same,
In the same
Prognosis.
year, right,
The
yeah.
same year in diagnosis.
Right.
So we've got, if I'm counting correctly, 15 so far, during the 2018-19 policy period, you've got 15 people fell into that category.
Right.
Creating 2,417,348.
Right.
So needless to say, we have some high claimants.
Absolutely, absolutely. Any other questions on that page? That one's pretty specific. The next page is the emergency room report. Again, we talked a little bit about this before. Your costs are up, your claimants are down, which is good. Again, you had 58 claimants this year compared to 79 last year. Total ER visits was 86 compared to 122, but your ER paid was much higher, was 233,201 compared to 93,553. So again, you look at that, and to me, it just seems because of the higher cost that they're utilizing it for more of an actual emergency as opposed to just going in because they got the sniffles.
As a book of business, Chuck, is this high? Is this typical?
This is typical. This is typical. I don't think it's high. You know, we can always do more.
Of the what, 28,000 lives you have in the trust?
Right.
This is pretty typical.
This is
of
pretty
emergency
typical.
room?
Yeah, absolutely. The numbers are about there. You know, for the size of the school, for the size of your population, absolutely. So we've got some that are higher, we've got some that are lower, but when you average it all together, this is pretty typical. The biggest thing that I would say what we can do is to help push more communication regarding maybe teledoc. You know, there's been some issues with teledoc that we're in the process of trying to get figured out and have it run a lot smoother, because it absolutely is not. And as frustrated as everybody is, we're absolutely frustrated as well, because it should be working for everybody. Everybody who calls in should be able to talk to a doctor, get a prescription, and have it be that simple. So we are definitely working that out right now, and we are going to make sure that we do it right and we do what's right for you guys. Sir.
Is it possible to present that median or average so we could see the answer to your question as far
Sure.
as are we above or below the average?
Sure.
Are we in the top range or the bottom range?
I can get that for you.
Not.
Oh, okay.
I'm not asking specifically now. I'm saying
Okay.
in the reports in the future.
Sure.
It might be nice to have that so we can see where we land.
You got it.
Are we
Okay.
right at that, median?
Sure.
Or average point?
Right.
Or are we high?
Or are you one of the higher ones or lower ones?
Right, and even if there's
Right.
some trend analysis.
Right.
Are we trending along an average?
Sure.
Or are we pinballing up and down far from the average?
Right, I get it.
Just a
No,
suggestion.
it's absolutely something I
which would
can put
answer
into the,
question and
yeah.
be more informative.
I can absolutely add that into the reporting.
I don't mean to create
on a
more
regular
homework.
basis. Oh, that's okay. Don't worry about that.
Thank you.
I'm sorry. Questions?
So we're-
Yes, I have a question. So, at the end of last year, we were talking about how we couldn't go to the urgent cares.
Right.
And so, has that been fixed, because that was supposed to be remedied a year ago,
Right.
allowing us to go to, the Warm Sea walk-in or the Valley View walk-in.
Right.
I do know I've had colleagues try and go, and it's still not being covered.
Right.
So where are we at in that process? Because then we have nowhere else to go but the emergency room.
See, Bulkhead City has an urgent care.
We have many of them.
Yeah, that is definitely in network. And I know we've had issues where it's been billed out of network, and those are issues that we need to be able to work out with that provider and say, hey, no, you're billing this wrong.
Well, because a lot of the providers at the hospital,
Sure.
this was an issue last year, the providers are not covered by our insurance.
Right.
So we're getting exorbitant bills or being made to pay that deductible up front.
Right, but when the facility is contracted, yes, thank you. When it's contracted, if you're going there for services, you don't have a choice of who you're seeing. So it's supposed to be billed correctly, and if it's not, that's why, and we have a lot of folks that reach out and say, hey, here's my EOB, I'm positive I was billed wrong, and we try and get that turned around as fast as we can. That's a conversation that we have to have with them, with the member, but also with that provider. Say, hey, you billed this wrong, recode it, whatever you need to do to get this down.
So is there
to
any
where
way
it's-
we can be proactive with it though, and you guys can contact these places that we're complaining about?
Well,
And-
Valley View and Warm Sea walk-in clinics are not covered.
No.
Only Dr. Wagner's urgent care place is covered. So I think sometimes we have people who go, oh, Warm Sea's covered, so they go to the Warm Sea walk-in clinic.
Right,
It
but
is
that's
not
different than the
contracted.
Warm Sea
Hospital.
Hospital, right?
But it
Yes.
shouldn't be,
They
they're the
changed-
same.
But it is.
They changed the licensure. Warmsy and Valley View both used to have urgent care, standalone
Right.
urgent cares, and they were
Right.
licensed as urgent cares. They relicensed them as walk-in clinics. So they've got primary care patients and walk-in clinics.
Right.
And they're no longer licensed in Arizona as urgent cares.
Okay.
So the licensing changed, plus you've also got some of the practitioners at both that are hospital employees of Valley View and Warmsy, and you've also got some that are rent-a-docs out of Vegas or Phoenix, or they're locums.
Right.
Who are coming up. And so when you're dealing with locums, you never know if you're gonna be a network or not.
Right.
Even if the facility says they are.
So that way you
That's
guys can
universal.
reach out to them and say, listen, we have a contract with you.
Right.
You guys need to honor this.
But they're not contracted.
They're not
Right.
contracted with.
Those ones are, the walk-in clinics are not contracted.
How come? Because this is a small community.
Right.
Because they may not want a
Only so many
contract.
people can go
Because
to
the actual
full-on.
physician might not want to contract with Aetna. They might say, I can get paid more from a person who walks in and get more money out of them as opposed to contracting with Aetna and being paid a flat rate.
But can we even try? Can you guys
I
try?
know we have, I know with like, Radiologic Associates, I believe. We did that, we were able to contract them finally. I mean, that was a huge issue with them in regards to imaging and being billed as out of network and folks getting really big, surprise bills at home, thinking that, oh, this is in network, and that doctor, finally contracted with, took a while, took
Months.
months. I mean, it took months for that doctor, but, and actually, and at first, he rejected it. And finally, we came back to the table and said, hey, how about this? And they agreed, which was great. It just didn't help anybody in the interim who was waiting or who went and got imaging done and got those giant bills because they're waiting. They're wondering what's going on. I'm getting calls from collection agencies saying you need to pay this, when realistically, we're getting that contracted so we can actually go back and rebill everything so that they, so you're not getting those calls. But a lot of times it's the physician not wanting to contract with Aetna.
Before we go do anything, we have to go online and check and see if they're.
The best thing to do is call and say, are you contracted with Aetna?
Okay, which
Well,
clinic
We
did
have
you
had
just say?
issues where employees call the Women's Medical Center up on the Parkway.
Sure.
And we're told by that clinic, yes, we are contracted, yet, and I said, they are not on the website, I am warning
Right,
you.
right.
I cannot find them by the clinic name nor the doctor.
Right.
So I'm telling the employee that, and the employee's telling me they're covered, and then lo and behold, they're getting billed.
Okay.
And I'm like, well, your doctor's office lied to you, I don't know where to go from there.
Well,
I was
it's-
told when we first changed from Blue Cross to Aetna, you have to ask them, are you part of Aetna POS2?
Yes. Exactly.
Because there's the other Aetnas that they cover, but not POS2.
Right, you
Okay.
have to be super specific.
Yeah.
You do have to be specific for sure. But if you're just asking if you take my insurance,
Well, no, they say,
everybody-
do you
right,
take Aetna? 'Cause that's
Right,
what it says
everybody
on
will
the
say,
box.
yeah, we'll take Aetna. They'll just bill it out of network. They'll say, yeah, we'll take Aetna, sure. They take Aetna for sure.
They do not specify that
But
they're gonna bill it out of network.
Are you contracted with Aetna? Here's my card. This is what I want to know before I go in. And, in an emergency situation, you can't do that. You don't have that luxury of doing that. And unfortunately, it's all these steps because of being a smaller town and, a smaller population with some of these physicians that either don't want to be part of it because they get more when they can bill
More
more.
from Blue Cross.
Or they get paid more from Blue Cross and we have to either match it or do better. Sometimes they just want to be a Blue Cross physician.
Yeah, at the hospital owned walk-in, I'm sorry, John.
That's fine.
You want to go?
Oh,
I had a noise that Warmsy walking clinics.
Right.
They actually go in there, you get your insurance card, you go in there, and they charge you your copay.
Right.
Okay, they tell you, what else is an employee to do, because they come up on the system from Warmsy.
Right.
As they take that network.
Right.
That employee now thinks he's employed.
Right. That is in network.
Because
Right.
a walk-in clinic.
Right.
So you're gonna go to, your ER visits are gonna be, on that higher level anyhow.
Sure.
And Dr. Wagner, you're gonna charge $50 plus 50%.
Right.
After, and they get charged that much.
Right.
So it's a higher level of charge, rather than taking the time and getting the contract or whatever.
Right.
With 4MC with the walk-in clinics.
Right.
Where your basic walking charge would be a inpatient visit.
It's an office visit copay.
Right.
Yeah.
And then that would be taken care of. Here you're paying twice as much in order to get the care that you might need at this particular time.
Right.
Or you're paying 3 times as much.
Right.
And your bill's gonna go up because it's not there.
Right.
So if you're talking these numbers, in order to satisfy those numbers and get those numbers down.
Right.
You would think that we would work on something like that. I mean,
Well,
that
I
would
know
be
there
the
is-
sensible way to do things.
Right. There is reach out to all the providers here. The biggest thing for us is that we want to be contracted, because not being contracted, right, and not having a contract with these physicians and urgent care walk-in clinics, whatever it is, that gives us, I mean, we look bad
Right.
to everybody.
Now, who's in charge of doing that? Who are
Right.
these people? Because when we were with Blue Cross Blue Shield
Right.
before, we used the walk-in clinic.
Right.
Us as a district paid a certain amount of price
Right.
per month for them to supposedly give us preferential.
Right.
Okay, now that didn't work out. Now it's the same doctor now.
Right.
So why wouldn't she be willing to work with us? I mean, who is the one going to talk to us?
But it also, one thing to remember too, with the hospital owned, not Dr. Wagner's clinic, which is independently owned and operated. And there's also a new walk-in clinic in Mojave that Dr. Mirza owns, Frank, not too far from your old office. I think he's turned that into a 24/7 walk-in clinic, if I'm not mistaken, at least from the signage that he's got. But the two hospitals own several walk-in clinics in the tri-state area. And the providers who are there, who are hospital employees, have no say whatsoever in the insurances that are accepted. If they're hospital employees, those decisions are made in Brentwood, Tennessee and Franklin, Tennessee, where their corporate offices are, because they've got full insurance credentialing departments at corporate
Right.
that are doing it for dozens and dozens and dozens and dozens of hospitals and urgent care centers within their chain.
Right.
So,
But if they're
if
hospital employees and we're covered by that hospital,
we,
you would
In-
think that you would be covered at the walk-in
in
clinic.
theory, except the site itself might not be. So that's, I think, where, whether it's ASBATE or
Right.
Aetna,
Right.
I think there's an opportunity to do some more outreach, probably higher up the food chain at the corporate level with the
Right.
credentialing folk, because Aetna's gonna know who those folks are.
Well, yeah, if it's but again, how far away is Fort Mojave compared to right here?
10-15 minutes.
10, 15, okay. I know some of the frustration also is having to drive, far,
Yeah, right, go to
too
Kingman.
far, right, Kingman right
Which is
now.
45 minutes.
Right, which is a 50
You know.
minute, 50.
So who do we talk to about calling these places and reaching out and trying to get them in our network?
All I can do is I can take the information that I get and bring it back to Aetna and say, look, we need to have more outreach. You need to keep me up on status. And then when we come back on a regular basis and meet, for me to be able to give you a status update on where we are. Are we bringing in some new places? Have we reached out and contracted? Because if I could present to you and say, we reached out to so-and-so, so-and-so, and so-and-so, and they did not answer our call, or they said, thank you, no, at
Then
least
at
it
least
gives
we
you,
know.
some answers.
At least
Exactly.
we know then that we're
Right.
not just being fed a bunch of malarkey and
Sure.
nothing ever
I
happens.
get it.
Because
Yep, absolutely.
our costs as employees go up when we go to urgent care.
Sure, absolutely.
And then our costs as employers go up as a result of
Right.
And if you get these, both of them, get that portion of it in control, you're gonna naturally lower things down.
Right. Which
For
is,
everybody.
makes everybody happy.
A couple of physicians that I've spoken to, when I've asked them why they haven't taken Aetna, is because they pay less than Medicare.
Right. Yeah, the percentage of Medicare
Exactly.
is not 400% of Medicare. You know, it's, you know, what are we paying, 300 and 350%
Yeah.
of Medicare, not 400% of Medicare. So that's the argument.
That's a
is-
big problem.
Yeah.
They're taking it, they're not gonna take it.
Right. So, and
When you have-
that gives me.
When you have two I'll just take an example. If you have two physicians, or even one physician, in an area that services a particular discipline or a particular illness or injury or whatever, and you want to get a discount, sorry. I mean, Flagstaff is the worst, absolute worst. Flagstaff is the worst place in the world to try to get the doctors and the hospitals to contract. They said, well, if they want to do it, they can go down the hill. If they don't want to come here, they can go down the hill. We're not giving you a discount. You can put us in your network, but we're not giving you a discount. That's what the hospital says. So, I mean, rural communities, it's tough sometimes to negotiate with the doctors and the hospitals to get the discounts that reduce the claims, that reduce your premiums.
And I understand that, but, and this has nothing to do with you or anything like that, but why did we not have these issues with Blue Cross Blue Shield then? Everybody was covered then, but now
No,
they're
not everybody was
because
covered then. It might be in this
Well,
area, but they weren't all covered.
A lot, well, I could go to the walk-ins, I could go to imaging, I could go to the hospital.
But
I could
have they
go-
changed the walk-in? I thought I heard Ross say that you changed it.
Well, just recently, yes, but before that, and this is before, and what I'm saying to you is, even before they changed the walk-in, we still couldn't go to the walk-ins with this Aetna plan. Okay, so yes, we are a rural area and it is more difficult, we understand that. And we're not opposed, like, those of us who live here, travel to Phoenix to go to doctors, go to Vegas to go to doctors, go to Havasu. We're not saying that, but what we want is somebody to come and fight for us here and try and get the doctors and the facilities that we have here for us to use.
Yes, I agree.
Yeah.
And the walk-in.
That's fair,
First step
absolutely.
taken.
Thank you.
And that'll be part, I mean, I'll make sure I incorporate that again into these reports. So that way we have those, and at least there's an update. I can't guarantee you that we're gonna all of a sudden, oh my goodness, we got all these contracts now. But at least this way you have a status
It
update.
would be nice, because then
Hey,
at
are
least
they
you know
even
you're
reaching
working
out?
for us and not
Right,
against us.
because right now, it's my word,
Mhm.
you know, which my word is good, but at the same time, you know, you guys don't know me like I'm a brother or anything like that, so, you know, it's like, you know, it'd be better to have that report.
Yep.
And if I can get that reporting and do a status update, that'll be
Thank you.
ideal.
We also
But
still.
just so you know, it did take almost 3 months to get the radiologist contract.
We do still need to address the website though.
Right.
The only urgent care we have is still not listed.
Right.
So if I tell my employee, please make sure that whatever facility you're going to is
Right.
in network, it is still not showing, Dr. Wagner is not showing.
Right,
So they have no confidence
right, that when they walk in, that it's
that
gonna
it's
be on
gonna be
network,
covered.
right?
Even
Chuck,
though
who
I'm
does
telling
that?
them,
Sign-
they're
does that
assuring
do
me
that
that it
website?
is.
Or you
Aetna,
do it?
yeah, Aetna does, it's an Aetna, the website, absolutely. Yeah.
And I don't know what to tell them at that point, because that's just my word isn't gonna get their bill fee.
Right, well, absolutely.
So Michelle, am I understanding correctly that Bullhead City Clinic Corporation is not one of our in-network urgent cares?
Just Dr. Wagner's office here on Raymar. And
Okay.
is that, I wanna say that's called Bullhead City Urgent Care or
Yeah.
something like that.
Okay.
That is the only one that I'm told is in network, but you cannot find it on the website as being so.
Bullhead, Dr. Stewart, Bullhead City Clinic, I believe, is the subsidiary, Warren C subsidiary for their walk-ins and their family practices.
Oh, okay, so
They've got
that's,
that as a
okay,
short
so it's not Warren C urgent care, it's the Bullhead City Clinic, yeah, okay,
Dr.
gotcha.
Wagner's got Bullhead Urgent Care.
Right.
but Warren C's umbrella for their employed practices.
Okay,
Of the walking clinic and the family practices is Bullhead City Clinic, Inc., or something similar to that.
So,
okay,
Chuck,
thank you.
I have another question. If it's licensed as a walk-in clinic,
Right.
can it be contracted as an emergency center?
Well, we wouldn't want it contracted as an emergency center if it's a walk-in clinic.
That's another problem.
why it would be a primary care physician.
Yeah.
Yeah, that should only be, we only want it to be.
So if they're licensed as a walk-in clinic, they can't call themselves an emergency center.
We never,
We never did, but when you went to an urgent care, it billed it as an emergency.
The only place you have to go is the urgent care, so they can only bill you as an urgent care. But we don't go to the clinics because we can't go there because we're not, it's not. under-
But even if they were in the contract, or covered under Aetna, contracted with Aetna, if they're a walk-in clinic, you can't go there as an emergency service.
No,
Or unless you can walk in and you think it's a
walk-in
lesser
clinic.
situation.
That's the whole idea.
Yeah.
It's a walk-in, you go in for a sinus infection instead of going to the emergency room for a sinus infection.
We're charged.
But again, that's a walk-in clinic, it's not an emergency room.
I know, we're not asking for it to be
Nobody
emergency
asked for
room.
an
We're asking
emergency
for it to
room.
be a walk-in clinic.
But we were talking about emergencies. I
No,
thought.
we were talking about not
Urgent-
wanting them to go
urgent care.
into the emergency room.
Okay, my bad, okay.
Anything else, you guys?
I got a question real quick on Teladoc.
Yes.
Okay, I have a 19-year-old daughter.
Right.
She's still a dependent on my insurance.
Oh.
Not insurance, excuse me, taxes.
Right.
I don't cover her on insurance, but she's still eligible for Teladoc as my dependent, correct?
Only the folks, I'd have to double check on that.
So my understanding answer to that is yes.
Is that, okay.
Okay.
It just depends on how the contract was written with the Teladoc.
Yeah.
But if that's what Dave's saying, then I'm gonna go with that
Yeah.
for right now, but I'm gonna double check.
That's what
it
I
also.
understand.
Okay.
But I'll double check it
Because
as
she's
well.
in college, I was trying to, I logged in today and it has her on there, but
Right.
said she has to create her own account.
She does,
She
she's
does.
over 18.
Okay.
She's
Yeah.
over 18, she has to create her own.
And how
Yep.
does that link to me, do you know? Like,
It doesn't,
so then how does she get it for free then?
because she's in, well, it's paid for as a whole,
Yeah.
so she's included.
Even though she's not a dependent on.
Well, she's 18, she's no longer a dependent in their eyes,
But I'm saying is like, even though she's not paying for her
Right.
medical
Or on the
coverage.
medical.
but it's, again,
It was in the
Teladoc's
contract
a
that
different
anybody in
animal
the house.
than your health plan.
Yeah.
It's a different animal.
Your phone and address.
Okay.
Not your,
I got a hypothetical.
Yes?
If I had a prescription that was running out or something, would that be something I could call in to them to have them give me a few days supply to hang me over, or?
You should be able to call your physician and say, hey,
Okay, but I was Teladoc.
oh, Teladoc,
Do they
okay,
write
so
prescriptions?
here's what happens with Teladoc.
Okay.
They will do that, they'll yell at you, but they will do that, because I've done that before. I've ran out of meds and I didn't have time to schedule a doctor's appointment, so I called Teladoc and just said, honestly, nothing's going on, I just ran out of meds, I need a refill. And they'll refill a month's worth of prescriptions, they'll do it twice a year, and that's it. And they'll pre-warn you too, don't do this, because that's what they said to me, so.
Okay. All right, good to know, thank you.
You're welcome. And that brings us to the Teladoc page, which again is page 14. And again, if you look down towards the bottom, it says Teladoc utilization since January 2019. You've had 81 visits. You've got 43.6% annualized utilization. I would say that utilization would have been a lot higher if we didn't have the issues with Teladoc that we have. 43% utilization is actually great. At the same time, it could be a lot higher and could be helping more people because of the issues that we've had. So again, we're trying to fix those and come up with a solution for that, so folks don't have that wait, or they're being told, I know they're being told by Teladoc that they were termed or something like that.
Well, they had issues for a while there, but I haven't had any recent.
Okay, good, okay. And that either means that it's running smoother or people stop calling.
It's
And
one or the other.
And I hope people didn't stop calling, because we want to make sure that this is a huge benefit. Teladoc is a great benefit for everybody. And, it would take care of your walk-in clinic, at least on a smaller level, in regards to sinus infections, respiratory infections, ear infection, anything like that, the flu, stuff like that. So it definitely could be helpful. Approximately 67.5% visits end in an RX. I've never had a visit where I've called Teladoc and they didn't give me meds. So I don't know why that's not 100%, but apparently sometimes they don't feel the need to give out meds. So, which is probably a good thing.
I was thinking of the scenario where you can't get an an appointment with a specialist
Right.
for 2 to 3 months.
Right.
And you're running low on a prescription.
Right.
And, you know, you want us to use Teladoc to save costs and everything.
Right.
And yet, the specialist, you know, it's a challenging
Sure.
situation for both doctors.
Right.
But at the same time, if it's a medication you're on
Right.
regularly,
Right.
why would either doctor discontinue or make you wait 60 or 90 days without a prescription until you can come in for a visit that they can't make
Right.
for 60 days out?
Right. It depends on the med. I mean, if it's a narcotic, you have to
Well,
go
that's
see.
controlled
But
by
like with my
substance.
asthma, you know, I mean, I have to have my asthma meds. But and they'll do it. They'll say, okay, we'll give you 1 month's worth of prescription, but get into your specialist or whatever you got to do, your pulmonologist, and get that taken care of because you know we'll only do it twice a year.
Gotcha.
On page 16, again, ASBATE wellness programs, wellness campaigns, on-site mammogram. Again, have we scheduled any of that stuff yet? Have you looked into dates?
They have contacted us and so we're waiting to see around what time we're gonna be doing it.
Okay, great.
We just set today the dates for our flu vaccination clinic that's coming around.
Excellent, excellent. I am hoping we get some great participation out of there. You know, you guys actually have had fairly good participation. If you look towards the bottom, your biometric testing participation, 31% participation. Not the greatest, but a lot better than a lot of districts. If we can get that up into the 45 to 55 percentile, I think that'd be fantastic. I know a lot of folks, you know, a little bit wary about giving blood, and they're like, well, what do they need this information for? And again, everything's de-identified, so there's really no concern for anything like that. What we're looking for is we're looking for anybody who is critical, maybe diabetes, and they didn't know that they were diabetic, or if they possible heart failure. Anything like that is what we're looking for, something that we can catch. Diseases of the blood, cancer, anything like that. We catch it all the time with a lot of other districts, so making sure they get the biometric testing done absolutely helps. We get a picture of the health of your population, that's it. We're not looking at individuals, but we are looking at that picture to show where do we need to educate folks on? Do we need to have education on diabetes or asthma or COPD or whatever it might be? So again, anything I can do to help out in regards to driving that participation, let's talk about that. And because that would be, you know, I always want to make sure we get that going.
Chuck, when
yes.
folks participate in that, then do they get their own report?
They can, and it gets sent to their physician so that they can have that conversation. It's a conversation driver. So when they get the biometric screening done, they can either get it sent to their house or they can have it sent to their doctor.
Okay.
I would always recommend.
You can get it online.
And you can
You
get
get
online?
an email saying that it's ready like 24 hours later.
Okay.
It says it's ready, you can go online, you can review it, you can do everything.
To me, it's a
When I did it
conversation.
several years ago, I got the
Right.
report, which is helpful.
To me, it's a conversation driver. You know, you take that information, you go to your doc and say, what is this?
Right.
You know, what do I need to be watchful for? And again, in some certain cases, it absolutely helps out. In certain cases, your doctor's going to say, you're super healthy. This is great. You know, keep it up. So, which is always a good thing. It's always a good feeling. And then disease management or nurse health coaching, which is towards the middle. Again, we're still looking to pay folks to participate in that. Again, $25 per quarter. So if you've got asthma, COPD, a heart condition, diabetes, talk with our nurse health coach. It's a conversation. You can have 4 conversations with her or him over the course of a year. Every quarter we're going to pay $25 to have that conversation. And all they're doing is checking to make sure. One of the biggest drivers of claims is the fact that a lot of folks decide when they're going to take their meds as opposed to take their meds the way the doctor said to take the meds. So, you know, that's like a ticking time bomb for a lot of folks. So they just make sure, are you taking your medicine on a regular basis? What meds are you taking? Have you ever tried this? It's all good stuff, and it's just that conversation. It's simple conversation. I appreciate everybody's time. Thank you so much. Any other questions for me? I've got a couple action items, yes.
Did we change prescription companies?
We did not.
Okay. Okay, my prescriptions that were like $2 and $3
Right.
last year,
Right.
last school year, are now like $10, $12.
Okay, so before I leave here, I'll give you my card. Email me your dose and your name. We went through, and they didn't put out communication, which this is, this was upsetting to me, but we went through the drug list. They took common drugs that folks are taking that they can either get over the counter or that there's a cheaper version of out there, like on a $4 list, like at Target or at Walmart or wherever. And they increased the cost on those because they wanted to steer people away, or if there's a different med that does the same exact thing that's cheaper. I know
So
it
they're
doesn't-
playing off.
I know it doesn't help. I know it doesn't help, but it's the pharmacies, the PBM, it's the pharmacy company Optum that did that. And so it has affected folks, but we've been getting overrides. So anybody where I can put in here's the drug, here's the dosage, this is all I need, and they'll put it on the list of, all right, we need an override for this one.
Okay,
Okay?
all right, thank you.
You're welcome. Yeah.
Oh, no, I was gonna say something, I just said that. But
Okay.
it was because my son takes medication, he's not with our insurance though.
Right.
And I, one time went to go get it and they told me it would be over $300.
Right.
When it's normally $60 a
Right.
month. And it's because it was the manufacturer. Well, the pharmacies don't have control over where they get their medications from. So
Right.
why is that the insurance does it that way? If, like, sorry, you're going to pay this much because we don't cover that manufacturer.
It's the different contracts that I've got a med that I take right now. If I go to CVS, which is my parent company, so I work for CVS. If ASBate, actually Meritane, is owned by Aetna, who is owned by CVS. But if I go to CVS, and for this med, I pay, it's $300, close to that. If I go to Safeway, and I use the GoodRx app, I pay $17. And I'm like, why is that? Because if I use the GoodRx app at CVS, it was still $100. It was $100 compared to $17. And I'm like, why is that at CVS? And they're like, it's just the contract we have with the manufacturer, and this is how it runs through your insurance.
Yeah,
And
like the Safeway sometimes has the right to manufacture
Right.
medicine.
Right.
Sometimes it
Sometimes
doesn't.
it doesn't.
So
Smith's
how do you-
always does, so I go
How
there.
do you do that with GoodRx though? You have to carry a paper script every time you go to get it refilled?
No, I have the app, GoodRx app,
Yeah.
and you can pull up the name of the med and your dosage, and then it'll pull up all the pharmacies
Yes.
right around you. And it'll say, here's the lowest ones.
But how does that pharmacy
And that
get my
doesn't work.
prescription?
Because, well,
They transfer it.
well,
I
you transfer
transfer
it.
it from one of them.
Right, you transfer it, yeah, thank you.
That doesn't work for
Yeah.
ADHD meds though.
I just wasn't sure.
But it does help,
Well, the GoodRx says that doesn't cover the ADHD meds.
it might be, I might.
In narcotics, it won't cover.
Yeah, it's not
Okay,
on there.
oh, really, okay, oh, okay, sorry.
No, that's fine. I just, sometimes I feel like.
Anything else?
They pointed out at the last meeting, the downside is.
Thank you all, I appreciate it. Thank you all, I appreciate it.
Chuck, I
Yes.
just have a question, but I would like to thank you. You guys have been very responsive every time I've contacted you about employees and issues that we've had. You've been very quick to get back to me and done a really good job on behalf of those that I have had in working for them.
Thank
So
you very much. I am trying. I honestly am trying for everybody's sake. I really want to do the right thing and make sure everybody's taken care of. So I appreciate that. Thank you so much. Here, just email me those
Okay.
names, okay? Awesome.
Thank you.
Okay, are we ready to hear from Emeritus?
He's ready.
Is this the right?
Yeah.
Yep,
Bottom
perfect.
top, good.
And I'll start off, I'll give you all the opportunity, trustees, Mr. Chairman, members, representatives. Rich Hanna again with Emeritus, meeting some of you today for the first time. Nice to meet you, seeing some familiar faces. Seeing some familiar faces in the audience meeting some of you for the first time as well. Had the opportunity to serve the trust, I believe, is it 4 years? Dave, I don't know. 4 years. myself, been with the company 16, have good and bad news today. So the pleasure of the trust, which would you like to start with?
And we've just had some bad news.
Okay, we'll start with the good news first. I'll get to the potentially bad. But comically I say this, overall looking at the numbers, I apologize for all those of you that don't have a printed copy. If we can see it on the screen, I promise I will answer any questions. We're through the tough stuff, compliments to Chuck. The big dollars, we're on to some of the smaller stuff, and your 32 teeth and your pretty smile. What does that mean to you all and the trust today? 43% roughly of the claims came in through preventive, so making sure we're taking care of overall your population's teeth. Not much different than the past report we did last quarter. Overall, the positive news, down 17.6% for the trust, for the schools on a year over year, down roughly $26,000. Total spend this year of just under $125,000 for your population. Reason being, really, we're billing less procedures. So 1,983 procedures billed compared to just under 2,300 the year prior. Of those procedures performed, less costly procedures, 6292 compared to 6677. Overall, so the population we have, less costly, them having less procedures performed, less people going to the doc. We talked a little about network in the presentation before. 92.6% of all your claims are paid in network. That's a huge compliment to you all in the trust representatives. We continue kind of on this path. So we built it from 4 years ago. We had much less of a network, thanks to you all and your partnership. Able to build and grow a network, continue to expand on that, and your plan now is set up to be network driven. What does this mean to us, all of us in this room? Really the savings overall provided through the administration, through the claim saving system, and through the network, roughly $105,000, 30% of the total bill charges. And what does that mean to the trust? For every dollar you spent in administration with Emeritus, you saw roughly a $6.22 return. I went through that really, really quick. I've got 50 pages to put you to sleep if you want to dig into it. I promise I can answer any questions in this. We did it year over year for the full report as well as just the month of July, if anybody wants to look into that.
Which one? You've got 3 of them.
We really don't have to. We've got 3 of them, but just for those of you who haven't seen some of these reports from us in the past, this itemized where every dime goes, every penny. So by ADA code, specifically broken out. By in-network, by out-of-network. So again, really definitive by procedure. For those of you that haven't seen these before, want to go through it, and any of the representatives, I can sure go through this, but again, in respect of time, don't have to if you don't wish to.
So what was the bad news?
So bad news. Do we want to get to the bad news?
Yeah. Yes.
Okay, so bad news. And this is tough because I don't have all the answers for you today, but literally I will read this verbatim. This is in results to a data breach Emeritus had on May 9th. So some of you may have heard this, may not have. This is just coming to us our way. So I want to make sure and give you all the tools that for if this any kind of conversation is coming your way, because this is extremely important, where do we take those conversations? What do we tell our folks? So on May 9th, Emeritus discovered a few associates fell victim to a phishing campaign designed to trick the recipient into providing their email credentials. Upon investigation, Emeritus determined that the additional associates were impacted at different times between May 1st and June 4th of 2019, concluded that as a result of the phishing campaign, a number of their email inboxes were potentially compromised. Emeritus addressed the exposure by disabling the unauthorized access and deploying a mandatory enterprise-wide reset. Over the past couple of months, Emeritus has spent significant time and resources further investigating the incident. Emeritus engaged a forensic firm to assist in understanding the technical aspects of the event and preventing future incidents. An e-discovery and incident response firm to identify what customers' data and accessible information and assist with any customer notifications and credit monitoring. Also as well, an outside team of legal experts to advise and assist with reporting obligations resulting from this incident. We have also notified law enforcement and will continue to work with them throughout our investigation. Unfortunately, Emeritus has determined that some of your members' information was contained in the inbox of one of the compromised email accounts, such as information may include individuals' names in combination with addresses, email addresses, dates of birth, social security numbers, member ID numbers, policy numbers, emails, employer names, and or policy numbers. On the advice of the council, Emeritus reported the incident to the U.S. Department of Health and Human Services Office for Civil Rights. As a breach of the unsecured protected health information on July 8th, the Emeritus submitted a report as a covered entity and business associate on behalf of the potentially impacted covered entities, including a general reference to plan sponsors like your company that did not identify such plan sponsors by name. Additionally, we began notifying individuals who may have been exposed by email boxes on July 8th. These notifications were sent on a rolling basis as the impacted individuals were identified and included in an offer for credit monitoring services and a phone number for potentially affected individuals to call with questions. We have already had one, if not follow-up conversations with the OCR and expecting additional calls and requests for information. We may include a request for the identities of the impacted plan sponsors. If you have any objection to Emeritus providing your name to the OCR, we ask you to reply to this business notification as possible. If we receive an objection within 5 business days from this letter, we will assume you have no objection to Emeritus disclosing your name to the OCR. At Emeritus, we put our customers first, and we work hard to earn their trust. Data, safety, cybersecurity are all important to us, and we are committed to protecting the privacy of our customers. Please know that we have a sense of urgency to resolve this as quickly as possible. So that's what the letter says. Yes, sir.
I received a copy of the letter. It was addressed to Riley Fry.
Yes.
So we would like to have my name added to that mailing list and distribution.
Of course.
My question was, how am I to know which of my members might have been compromised? And how would I have responded to that letter without asking all of my members who believes they may or may not have? And how would they have known if they were compromised?
So this is something, again, unfortunately I don't have access to, so I will make sure to your request, make sure your letter, really, and everything I've been advised to, because this is a legal matter, is we have a team. We have multiple teams outside of our organization as well as inside our organization. So I want to make sure and turn you over to them rather than have them call yourself, have them call me, because we want to really make sure from a legal perspective also as fast as possible from their perspective that we get that information out to them, and how do we address those conversations.
And I understand phishing and all of the access to information is being compromised, whether you're shopping at Target or, these things are happening.
Right.
And the law division of your office is doing their due diligence by sharing with us that this compromise occurred. My question has more to do with, what am I to do with a letter like that in 5 days, given 5 days to do a survey of 150 employees? I wouldn't really know how to act on that without your company giving me the information that employee A, B, and C were compromised.
Right.
I would reach out to them and ask them how they would want me to respond for them.
And again, I can't speak to the 5 days with the OCR and surveying your employees. I don't know that I'm qualified to answer that legal question. Again, I want to make sure you speak to it with Kate and our team. I think it's a legitimate question. If I don't know who I'm supposed to be surveying, where do I take this letter? Where do I take this conversation? So I think you're right. I think in the communication of this, they're still figuring out how best to communicate. So I think that's hence the 3 companies we brought in from the outside of when, where, timing. So I appreciate it. This is some of the information I have. I don't have all the answers, but I want to make sure any answers I do have for you all especially, and for the trust, that I get those to you as soon as possible to say, here's the information I've got.
And then to further complicate things, I never got the letter.
Okay.
For Bullhead City Elementary. So.
Okay. Thank you for saying that.
No, we don't want to panic anyone, but the thing is, we can't do our part.
And I agree with you both. I think the communication and where the communication starts versus trying to tackle the communication from the back end is a big thing. So, like I said, a lot of this information is just coming my way.
So I guess what I'm saying is, I've actually received a letter like this from my bank.
Okay.
Right? And I know nothing happened with my account. So I know, me personally, I'm good, even though this large national bank has been compromised. My account was not. But if I had noticed a large withdrawal or something, yeah, I'd be calling that number within 5 days going, I need help. Something did happen with my information. my account. When a letter like that comes to me and I am responsible for many individuals, how am I to know and respond within 5 days without getting some subsequent information so that I can respond within 5 days and say, yes, I have 2 or 3 or 5 or 10 employees that have been compromised by this fishing expedition, and how do I advise them to how to proceed?
So,
in terms of the protection of their identity and their information and the confidentiality of their records.
So by all means, and I think if I'm interpreting the letter and interpreting the conversation, I don't think that the 5 days was responsive or the request to gather your people.
Right. And I wouldn't reach out and ask them because it could send a concern unnecessarily.
And again, I think the 5 days is really the objection of using your name specifically to the OCR. So again, this is my interpretation of that, not necessarily dealing with your staff and making sure that we notify them within the 5 days. That's my interpretation of it again.
And again, I would say yes.
Right.
If I knew what yes, provide my name to the OCR, or no, it doesn't. Again, I would need more information before I would want to be able to say that. Now, my answer might be, yeah, I'd like to know more and have OCR look into this further.
Right.
So you have my thumbs up on that.
Right. I think valid point.
Could you ask your legal team to reach out to me?
Yeah.
And walk me through this a little bit more so I can guide, and I'll certainly share it with Dr. Stewart.
Why don't we put a conference call together between your attorney and the two of you?
Yep, I think that's for any of my clients that I'm getting this information that a specific client has been affected. That's my aspect to my team is who specifically was affected and when as soon as possible can we get a phone call together. So I appreciate the feedback. I will definitely take that back to my team if I can work with you both and Dave to set up a call. Again, unfortunate news. By no means don't want to say it's today's society, it's today's world. It happens, I understand. Has happened in the past. Not something we look forward to or having the discussion, but definitely want to make us all aware of it. Here's what I know so far. More information to come, and I want to make sure for any of you to get any questions, if anybody that got a letter, where do we guide them to go?
May I ask how they were contacted, whether it was via email, a written letter, or both?
From Emeritus for the individual. So if it was one of your associates, it would be a letter, as my understanding. Right.
Okay, and then if they were going to receive a letter, would they have already done so, or are those still in progress?
It's my understanding anybody that they know that has been affected has been a letter mailed out, but it's my understanding, read the information I got, is as the investigation is ongoing, if they find more letters,
find more additional,
right, continue to go out. And from what I've read into it so far is in an email. So again, this is my interpretation of it, not a legal expert opinion, but email. So if I read through it and interpret it my own way, if a name was in any sort of email. So from the research I've done, better than a data breach. Didn't make it to server, didn't make it to guarded information, but made it to an email.
Well, and I'm quite aware of what I send in emails to them. I don't tend to send protected, highly confidential information. I may have to enter a name or a birth date in an email, but I'm not giving out social security numbers and things like that.
Right. So, but by no means, I think still, if it's a name, if it's an address, if it's any kind of any one of our personal information, right? I want to know about it. That would be where I would, as an individual, I would want to be notified of it. So again, much more information to come. I'm glad to see that we've also hired external firms, not just handling it internally. So thank you. Good questions. If any of you get more information like this, again, some of you have been through something like this in the past. I have not personally dealt with it on a professional level, so I'm in a learning stage and kind of going to my experts to say, what does this mean? So that's the good news. This is the bad news I have. Any questions on either? Okay, thank you all again. Really appreciate the time.
Thank you, Rich.
Okay, I noticed we're supposed to, we can't vote on it, but it said to approve a requested administrative fee through 2024. Did you have information for us to see on that?
That was on the last board meeting, and it was, I can't remember, Rich, it was, increase in the administration fee?
I can sure go back and look at my notes. I didn't have that in my notes.
But
Okay.
You can't vote on it, so
Right,
we'll
we
have to
can't
bring
vote
it
on
back
it.
next one.
Yeah, all right, thank you.
Thanks.
Okay, VCD. Is usually the longest one, right?
No, and it will be short again today, too. For those of you who I haven't met, I'm Reed Nelson. I'm with Vision Care Direct. We are your vision benefit. What I want to do mostly today is just hit the reports very quickly because frankly, our reports are small. They don't fluctuate typically, and the only time you'll see that bottom line number on page 2 vary is when it kind of really depends on when July 4th hits and when claims are filed by doctors for services performed in June, were they filed in June or were they filed in July. Other than that, vision is really stable. What I'd like to do mostly today is listen. We did this over with the representatives here about 1.5 years ago. We started getting some feedback about the vision plan and said, it's a great plan, but we can't get glasses and contact lenses in the same year. And so we presented some plan and some ideas to the board, and the board and you all thought it was a good idea. We implemented that. That's because we heard what you wanted for us to, wanted you to do for us to do for you. So if there's additional feedback like that, one of the things last minute, as I switching stuff from one car to another today, I saw a box of these sitting in the trunk of my other car, and I thought, oh, what a great idea. Let me throw some in. Normally we pass these out at open enrollment time, but since we're not here during your open enrollment, I thought, well, I'll just throw a lot of these in. I have enough for the elementary and some of the high school. I think there's a definite size difference between your two high schools. I've got enough for you. And I'll get a count for, I can pull that off of our reports, and I'll get a count for your people next time. And we'll make sure you get some of these for next time around. As you're passing these out, if you can get some feedback of what more you would like to have us do for you, let us know. And if anything bubbles up to the board, we'd like to hear about it, what we can do a little bit differently. Probably the most significant thing we did when we added that secondary benefit, if you'll notice on the first page of the report, you'll notice there's a number down here which represents the discount you receive by going in network. Well, when we added that second benefit, that was, for those of you who want glasses and contact lenses, you immediately received almost an additional 60% off by having that benefit available. Plus the fact you can run it through payroll deduct, which is an additional discount. So as you're talking to your people, listen and let us know what we can do more for you. We'd love to help. Other than that, board folks and representative people, yes?
Just one thing, and I think it's the same database last time, not on the bullhead side, but on the crushed side, on page 3. It looks like Dr. Jones and Dr. Corbridge's, or Dr. Jones and Dr. Widdison's stats were reversed.
Oh, you know what I did on that page? Because the last time we had the meeting was on June 24th, that's when I pulled it. And what David requested this time is we only go up to the end of the plan year. So I thought, okay, for 6 days more, I didn't go back to that page. So I apologize. On page 3, it's the same numbers you received on June 26th, same numbers this time. 6 days is going to make a big difference on which provider was seeing the most patients. But that will be caught.
I did notice there is sometimes a difference between platforms. If I search providers on a PC versus a tablet or a phone, certain providers show up on one and not on the other.
You make sure, and that is a really interesting thing. When you search the provider, sometimes some of the applications limit the check boxes. And so you need to make sure you have all the check boxes listed for the people you want to see, because we have safety programs, we have people who do special medical care. You need to make sure you have all the boxes checked. And some apps don't open up all those boxes.
Right, the people that we were looking at showed up on the tablet and the phone, did not show up on the PC site. It was just a, what was, do you remember who that was?
Which browser?
Well, we only have two. Is it Jones or one?
No, it was somebody,
Jones
it was
didn't
somebody
show
in Kingman. And we were looking,
It didn't match, right?
right, for whatever reason that day, it did not match. They were on one and not the other.
And you don't know which browser you were using?
I would have been looking through, Chrome.
Wrong, yeah.
So the Chrome is the one that limited, okay?
I want to say that it was Chrome that limited, and then we, the phone and I'm assuming tablet, because the employee I was talking to, is like, I went here and they didn't pay it, and I said, well, are they in our network? I said, I don't see them listed, and he's like, yeah, they're there, so I went and looked on another platform. I asked him, which platform were you using? Were you on a PC or a tablet or a phone? Because I know that sometimes can play a difference in how sites load. And then I was able to find that provider. So we went ahead and asked them to reprocess that claim.
And did they?
They're working on it as of now, as far as I know.
If there are any issues, will you contact me directly?
Certainly.
And I'll get it taken care of. And that's good to know. If you can tell me which platform it was on, sometimes we have to go back to the platform people and figure out what format they want that information served up, and I can get that to our IT department. We have a really responsive IT group, so they're able to and they want to know that stuff, because that happens all throughout the country.
Yeah, he was able to send me a screenshot of his phone. So is there a date on here? So I can say, look, it was covered on that date off his phone. And we weren't able to get a date with that picture, but I was able to pull it up on my phone and find it there, but we couldn't find it on the PC.
Interestingly enough, the browser that we have the most complaints about is Chrome, which is the biggest.
Right. It was an odd one, but it's being handled.
Okay, so it's just how it's serving up that box, where we make sure we get all the boxes checked.
I will look through that again tomorrow.
Okay, cool. Thanks. That's it?
Yes, thank you. Okay, do we have someone from Alliance Work here?
That would be Ken.
Good afternoon, everybody.
Good afternoon.
Good afternoon, trustees and chairman. So I'm with the Employee Assistance Program. That is one of the ASBATE's many benefits. The idea behind that resource is to help your staff manage change better. So has your staff ever, or the staff of the schools, ever experienced stress? Most likely. So with that in mind, we have this resource. All employees have this resource, regardless of their medical plan. ASBATE provides that to all employees and anyone in their household. So, yes, perfect. So if anyone's interested in this summary, there's copies here. It's all set up on the screen, but I want to draw your attention to some of the historical comparisons, and I'm a firm believer in looking at what's in front of us instead of what's behind us. But the main thing is what's behind us. That's something that we can figure out what we want to do from or react off of. So when we look at 2018, 2019, Bullhead City versus Colorado River, you'll see a difference in the utilizations, about 3% and up to 7%. Kudos to Michelle for doing a wonderful job of promoting this resource. You'll see from 2017-18, there was a dramatic jump for Colorado River. And the idea behind that is the more likely, or employees are more likely to use this resource when they are familiar with it. And Michelle's done a wonderful job of not only getting out our monthly publications, spoke with John and Michelle prior to this meeting and feel very secure in their approach. A lot of the ideas that we discussed, they came up with to really get the employees to use this resource. Because when we look back to 2015-16, we see pretty strong utilization. 17-18, it dropped down, but I think we are on a curve upwards from 2018-2019, particularly from that conversation I had with Michelle and John this afternoon. When we look at education, it's about 2 to 3%. ASBATE as a group is around 6%. So if we can get up to that 6% and above, and if you can think back to the medical claims today, about 7 to 10% of your medical claims are coming from, or your medical claims are coming from about 7 to 10% of your population. Same idea with your employees. About 7 to 10% of them are impacting the rest of the employees with their personal issues. If we can get them to help, most likely you're gonna see higher rates of productivity, better engagement, but more likely, people having a lot better days. I want to draw your attention to the resource room that we recently created. John and Michelle had a couple ideas of how to get that information out in front of the employees. Again, that's an issue of just getting people familiar with the resources. That way they're more likely to use it. The idea behind that is when we're stressed out, we get very defensive and we kind of close down. Where when we've heard something before, and if you think about it, most people need to hear about something 7 to 10 times before they'll act on it. That's the importance of this regular information. So we've supplied them with wallet cards, they've got posters, they've got flyers, we have that resource room they can put online because we've talked about today, people go online when they have questions. That resource room is a great place to start. We don't include the website utilization, which you'll see for ASBATE as a group was 44% increase. When you think about your millennials, when they have questions, they go online before they'll ever want to talk to somebody. The other part of it is your millennial population, a lot of those are moving into leadership roles. They're more comfortable with online resources. That's something that we've really made an effort on providing more robust features, more importantly, providing those resources in a friendly way. When we look at the utilization, I always look at it as not necessarily what we're seeing, but what we're not seeing. And what we're not seeing is a lot of use from dependents and other household members, primarily employees. This is some of the things we talked about in the meeting with Michelle and John, which I think we're going to see some positive increases in this coming year. When we look at the problems assessed, normally when people think about counseling, they think about crazy depressed people, right? Where in reality, when people are going through personal issues, whether it's financial issues, medical issues, occupational issues, substance abuse, family, relationships, there's a lot of different reasons why people want to work with a counselor, but sometimes they're not familiar with why they should work with a counselor. This is where the communications comes into play, and from what Michelle and I have spoken about, she has a really good way of getting people to see that the EAP is more than just counseling. And that was one of the things she mentioned, was employees were surprised by the variety of resources that are available. And that's demonstrated really well when you look at the difference between 2017 and 18. We see, instead of it just being emotional and psychological and occupational and family issues, we see the addition of financial, medical, occupational, relationships, and legal and family issues. That's why the utilization rates climb. I want to draw your attention to the resolution rate, 75% and 100%. What that tells us is when people are using the employee assistance program, they're getting help. Their issues are getting resolved. What that does in total is lower your healthcare claims. Because if you think about when employees are stressed, they get sick and their health suffers. But when they learn good solution-oriented counseling resources or tools, they deal with their stress, they have healthier, happier relationships, your medical claims will go down. When I draw your attention up to the about the middle of the page, the estimated cost reductions, you'll see about $14,000 for each group. Every employee that uses an employee assistance program saves the district money. It's as simple as that. The more employees that you have using this resource, save you guys money so you can spend your money elsewhere.
How much are we paying you for this?
It's included in the ASBATE medical.
Okay.
So there is no...
There's no additional charge.
Exactly.
All right.
So with that in mind, the more you use it, the better it is. Want to draw your attention to, not everybody is going to want to work with a counselor. This is one of the reasons why we provide those 28 personal and professional development webinars. Yeah, nice part about the webinars is they're recordings. We also do them live, so if someone wants to attend a live session, they can do that. But most people, particularly school teachers, they are in class, so they can watch those webinars, and we do everything from conflict resolution, communication skills, resilience building, a variety of different topics, because at the end of the day, most of us need some encouraging words and some tools to deal with the stress we face. Any questions about any of the content I covered? I tried to speak quickly, so thank you so much for your time. We are very happy that you select ASBATE as your provider, and just want to remind you that this is a resource that helps lower your healthcare claims. Thank you.
Okay, any future topics we need to discuss now? right, how about from the site ambassadors, any future things you'd like to see on the agenda?
Other than what we've already discussed.
Right. Okay. Do we have any need to change the upcoming dates we have on here?
Yes.
November 27th.
November 27th is the day before Thanksgiving, and there's not a school in the area that will have an attendance.
What would be a good date for the trustees and the school district?
Can we back it up a week? I mean,
Or can we push it like way forward?
Yeah, either way.
We've already got one scheduled for January.
there's already a
But
January.
you can push January, you can push January further into February if you wish.
Or can,
So do a January and a February?
You can do that, or you wanna push it to March, because usually, what I try to do is get reports from the vendors, and the vendors usually try to get the reports out somewhere between the 15th and the 20th, that's why I push it towards the end
we
of the
have
month.
open enrollment usually in April, is that what Ronnie said?
Yeah.
Open enrollment,
Usually we've
Yeah, a
been
little
trying to
earlier,
get,
hopefully.
pricing and all that.
usually we try to have a meeting before you're getting ready to issue contracts in case there's any changes there.
So do you wanna do a January and February?
It might be nice so you have the ability to follow up before you're issuing your contract.
So what's your date in January, the 22nd too late, or you wanna?
No, that's probably okay, and then you could probably have one about a month later.
In
Is there a
February?
reason it
Okay.
needs to be on a Wednesday?
No.
Whatever you guys want.
Just can't be the third Thursday or the first Monday.
What about the Tuesday, January 21st? We're doing away with any before then.
Right now, right now, that's okay with me. January 21st instead of the 22nd?
That's fine.
Okay,
Okay,
and then a month later?
Tuesday the 21st.
And in February, what? Again, push it beyond, like, today. Today I got the report that you saw with regard to the July paid
About
claims.
February 18th.
You wanna go the 18th or 19th, Tuesday or Wednesday in February, keeping it a month away? from-
Probably won't have the reports.
How about the end of February?
Later? You wanna go
Yeah,
25th or 26th?
yeah, either one of those.
25th or 26th of February?
Either one's fine with me.
You wanna
It's
go
too far
back?
out.
I'm sorry?
Yeah, it's so far out, there's nothing else on anyway.
Yeah, I'm just saying, do you wanna go back to a Wednesday or stay at?
Tuesday or Wednesday's fine.
Ms. Nestor?
Will
I
you-
will tell you that if you leave it on Wednesday, I have to be gone at
Right, then we'll
5:15
do
at
it
that
Tuesday
time
then.
of year.
We'll-
I will just get up and walk out. So
We'll do
if
it
you want me, fine.
Tuesday's
If
probably
not,
good.
Let's do
it doesn't
Tuesday.
matter.
No, we
Let's
need
do
you.
Tuesday.
We want you and
Let's
we
do
need you.
Tuesday.
So it needs to
Tuesday.
be on a
Okay.
Tuesday.
And then that'll be February 25th.
And as always, it can change when we have our meeting in January.
Okay.
Cool.
All right, so if there's nothing further, there's not enough of us to vote, so we should just adjourn without a motion.
There you go.
Thank you very much, everybody. Thank you. Appreciate it. Thanks for all your feedback.
Because any decisions they make usually, they involve, right, I mean, they usually have to go to the district or to the regular school board, kind of sorry.
I'm just gonna put right here.
How's your young community?
Yeah, I don't know.
So we need to, Todd and I are going to have to know.
Not to mention, I think some of them, they would have, right,
Exactly. I don't think they're gonna do that.
They're not done anymore.
That's what I said.
Eight grandkids.
I said, we have 3 kids, he's at 25.
He's over there.
Oh, he's over there.
Put down.
oh, wait.
Always good.
Thank you. Oh, you're welcome. Yeah, and I will be in touch.
Question that, I think it is happening.
But it's unfortunate.
personal. It's only personal. It's only personal.